This is the last in the lecture series talking specifically about the theories themselves and how they apply to spiritual and pastoral counseling. We'll be talking about Carl Rogers and person-centered theory, and then in the next lecture we'll talk about Gestalt with Fritz Perls. And then after this, for the rest of the course, we'll be talking about specific situations. We'll be talking about the application of theory. We'll be talking about different types and different forms of pastoral care and counseling. But this is the last two lectures on specific theories themselves. So let's look at Carl Rogers and person-centered. Wasn't always called person-centered. So let's look a little bit at the history. Carl Rogers was the director of the Rochester Guidance Center, a society for the prevention of cruelty to children. He was working with mother and child and didn't see a lot of change. Child displayed a lot of serious behavior problems. He discussed a lot of things with them, but eventually, because he wasn't seeing positive change, he had many sessions with mother and child for no cost, and eventually decided to terminate therapy. But then the mother asked if he provided adult counseling, and she began to share a lot of her personal story and had an authentic desire for help. He discovered a lot of things that I discovered myself working with children for many years, being a child therapist, working with COIS and private practice and clinical mental health and school counseling. Many times children display different behaviors, exhibit different symptomology, receive different diagnoses as a result of their environment, whether it's parents or caregivers or other situations, foster care. Children often have difficult lives. But one of the things that Rogers determined as a result of this is that he wanted to really trust in the client's potential for self-awareness, to be present as an active listener, and he believed in the potential for growth in his clients under the right conditions. So we moved through this. He eventually began teaching classes in the Department of Sociology at University of Rochester, and one of his first books was The Clinical Treatment of the Problem Child in 1939. In 1942, he accepted a full-time position at Ohio State University. He wrote a unique and controversial book, Counseling and Psychotherapy. Non-directive therapy. This is when his theory really began taking shape. Developed in the 1940s, was initially a reaction to psychoanalysis used by contemporaries. He really didn't believe in the medical model, didn't follow psychoanalysis himself, wanted to eliminate diagnoses, interpretation, advice giving, and instead he began emphasizing feelings expressed through reflection, summarization, and clarification. These are some of the most basic skills that any therapist can incorporate. It's the basis of our Counseling Skills and Techniques class, and even though it sounds very simple, there's a lot of skill involved in using these techniques properly. And we're going to talk a little bit about these specific techniques in just a little bit. So he called this non-directive therapy. He allowed the client to direct the therapy, and he reflected, paraphrased, summarized, and clarified. So as time went on, his theories continued to develop, and eventually he moved to client-centered therapy. It did have some philosophical underpinnings, kind of a homegrown variety of existentialism. And when providing a climate comprised of the specific counselor attributes of congruency, or genuineness, unconditional positive regard, or acceptance of the client, and accurate empathic understanding, people become more flexible, autonomous, self-accepting, and self-actualized. So these are 3 therapeutic attributes that the counselor needs to possess. So, congruency, genuineness, unconditional positive regard for the client, acceptance of other, and accurate empathic understanding, understanding the client's subjective reality from an empathic viewpoint. Those are the 3 attributes that he believed all therapists needed to possess. We'll talk about each one. So as a result, he began to experience very positive relationships and personal mental health in the clients as well. In 1951, Rogers wrote Client-Centered Therapy, very successful book, shifted the focus from non-directive methods to the phenomenological world of the client. And the concept of phenomenology is very closely connected to that I-thou concept in existential philosophy and existential therapy. The actualizing tendency becomes the primary motivation for change. By providing the appropriate environment, positive change will occur. And by the appropriate environment, he believes it's the utilization of those basic skills and techniques, the incorporation of those 3 attributes in therapy, and a trusting, non-directive environment with a focus on phenomenology and empathy with the client. And then person-centered therapy. The theory is still evolving. It expands upon aspects of existential therapy and phenomenological humanism. Etymology of Phenomenology originates in the Greek phenomenon, referring to a phenomenon or that which appears or shows itself. He held to the view that the counselor and client relationship was the basis of his theory. He believed that establishing an atmosphere in which the relationship can grow facilitates the individual's move toward greater self-direction, self-awareness, positive change. The optimal situation focuses on the combination of the counselor's attitude and the client's perception. There needs to be trust, confidence, acceptance, a democratic style of equality between the counselor and the client. He wouldn't even call them a client anymore. The person, 2 people, experiencing that dynamic, that therapeutic dynamic. Goals are oriented to personality rather than symptoms, diagnoses, or curing of a disease. Client has to feel that he or she is being heard in a non-judgmental manner. It's not enough for the conditions to exist. They have to successfully be communicated as well to the client. So Carl Rogers reminds me a lot of Fred Rogers, Mr. Rogers' Neighborhood. Mr. Rogers was a master of using person-centered techniques. And you can see that in all of his interactions with children. When I was in my doctoral degree at Duquesne, I used to attend 6th Presbyterian Church in Squirrel Hill, and Fred Rogers sat across the aisle from me. He was actually a Presbyterian minister, and his PBS show, Mr. Rogers, his neighborhood, was based in Pittsburgh at WQED, and he has really a strong connection with the Pittsburgh area, and he was just a really nice guy. Let's see, Therapeutic Attributes. This article talks specifically about school counseling and the school counselor, but that's just because I wrote it for a school counseling handbook. You can apply these theories and techniques and attributes to clinical mental health, to private practice, to adults, to children, to pastoral and spiritual counseling. So just because it says professional school counseling, it's just because it was written for that audience, but you can apply it to any population. So, congruence, also known as genuineness or realness, is the therapeutic stance when the professional counselor presents her or his real self, rather than taking the position of an expert or distancing or becoming fake or false in some way. The professional school counselor or counselor has the ability to maintain her or his own self-identity and convey this to the student or to the client. So let's look at the term congruent. The term congruent is one that, and this is a quote from Rogers, I have used to describe the way I would like to be. By this I mean that whatever feeling or attitude I'm experiencing would be matched by my awareness of that attitude. When this is true, then I am a unified or integrated person in that moment, and hence I can be whatever I deeply am. This is a reality which I find others experience as dependable. So it's really that authenticity of self that allows trust in the counseling relationship. Second attribute, unconditional positive regard or acceptance, implies that the counselor believes in the client's innate possibility for positive growth. So, unconditional positive regard and acceptance doesn't mean that I accept whatever the client does. For instance, I might have a person that's done horrible things and has been arrested or incarcerated. It doesn't mean that I agree with their actions. What it means is that I believe in them and accept them as a human being, as somebody who is capable of positive change and a positive life. As a second condition, Rogers finds that the more acceptance and liking I feel towards an individual, the more I will be creating a relationship which he can use. By acceptance, I mean a warm regard for him as a person, of unconditional self-worth, of value, no matter what this condition, his behavior or his feelings. It means a respect and liking for him as a separate person, a willingness for him to possess his own feelings in his own way. So let's talk about the unconditional aspect of love and acceptance. So many times, children are taught that love and acceptance is conditional, whether it be conditional upon their actions, their grades, their behavior. If a person believes and is taught that love and acceptance is conditional, they not only try to please others, but they become judgmental of self and others as well, rather than not only believing that they are worthy of unconditional love, positive regard and acceptance from others, but they need to understand that they can accept themselves and love themselves. So this is a key component in acceptance of self and the belief in one's own value, that one deserves unconditional love from others. Without this, people try to please others. People change who they actually are for others' acceptance. People try to live to meet other people's standards. And people don't accept themselves, and that results in negative self-talk, a lack of self-efficacy, lowered self-esteem, codependency, perfectionism, self-doubt. So when somebody comes into a counseling session and they have not experienced this from a young age, and they begin to experience it in the counseling session, that becomes a model for a positive, healthy relationship. Cochrane found that the counseling relationship, which includes the Rogerian attribute of acceptance, facilitates change in clients with conduct disorders. In the most difficult situation, clients with conduct disorders display negative behaviors resulting from the client's maladaptive beliefs concerning self, and how she or he fits into her or his phenomenological world. Ongoing experiences of rejection or non-acceptance by others lead to feelings of emptiness, depression, existential non-being. It's all about self-worth. Behavioral responses result in a disruption of learning, inappropriate social interactions, or aggressiveness. It affects relationships in a negative way. It affects happiness, self-acceptance. This behavior not only impacts individuals, but others as well. Families, teachers, co-workers. May result in the creation of labels such as troublemaker, or placed in a counseling environment that emphasizes unconditional positive regard and acceptance. Client's assumptions that she or he is unloved or uncared for are challenged. And I would go so far as to say the assumption that they are not worthy of unconditional love and acceptance is challenged. So this creates a motivation for positive change. So it's a key component of any belief system. So when we think about being worthy of unconditional positive regard and love, it begins with relationships, parental relationships, then relationships with friends, significant others, colleagues, students, peers. But then it's kind of moved inwardly to one's acceptance and love of self. And ultimately, it is extended beyond oneself to one's spiritual belief system. So, for instance, when I was younger, I had this issue myself. And I was constantly thinking that I had to be perfect to accept myself as a good person, to be loved by others and accepted by others, and ultimately to be accepted by a higher being. And once I began to examine this and experience these positive love and acceptance, I learned to not only accept forgiveness, but to accept grace, to embrace imperfection, to believe that I was able to accept love and affection, and believe that no matter how imperfect I was, or anybody is, we deserve to be loved, forgiven, accepted. It was always easy for me to forgive others. It was difficult for me to accept forgiveness and then to ultimately forgive myself, or to allow myself grace and forgiveness. For some reason, I might feel as though, oh, I don't deserve it. Ultimately, I realized that that was actually my ego talking, my control issue. And who am I not to accept grace? So, many times I'll find that in spiritual counseling, this is an integral issue, that people believe that love is conditional. And as a result, if love is conditional, forgiveness is conditional. And even though they might ask for forgiveness, whether it's from another person, or from a higher being, or from themselves, they may not believe that they deserve that forgiveness. Well, nobody deserves anything. That's what grace is. Grace is love for everybody. Forgiveness, even if you don't deserve it. So, giving up control and being able to accept love, grace, forgiveness is the result of unconditional love, positive regard for other and self. And we can talk more about that. The motivation for change. He believes that people change is inherent in individuals, yet positive and lasting change may be more difficult if there are barriers which the individual is unable to overcome without a supportive environment and a helping relationship. When people are experiencing any type of change, positive change or negative change, one of the results of change is anxiety. Even if it's for a positive thing, such as getting married or moving into a new house or getting a better job, change still results in anxiety. And negative change is more anxiety producing. But through awareness and a better understanding of unconditional positive regard, that creates a motivation for change. It's also important to help an individual identify the phenomenological motivation, to genuinely engage the individual in dialogue, to understand their subjective reality, their feelings, unconditionally, to communicate accurate empathic understanding that reinforces the initial motivation to change. There's lots of motivational things. Self-awareness is key. The search for meaning promotes change. Understanding our real self becomes motivation for change. So let's talk about real self and ideal self, congruence and incongruence a little more. So, Rogers believed that individuals are motivated to realize their innate possibilities, leading to the actualizing tendency or self-actualization. An integral part of actualization is the process of differentiation, which generates a concept of the self, a symbolic representation of who one is, and an ideal self, a representation of who one wishes to be. There's a large discrepancy between the real self and the ideal self. Incongruency results, and the individual experiences more anxiety. So first of all, an individual has to understand who they are right now and all of the imperfections. And that's not to be negative or to be critical. It's just an understanding of who I am. Am I being real? Or am I being false in some way? Am I trying to live in a fictional way to please others? What am I doing that is not genuine? So first of all, we have to understand, am I being genuine? How am I living that is not authentic right now? And then, so who am I right now? Am I authentic? Am I false? Am I living for others? Am I living for myself? So we have to understand that right now. That self-awareness. And then we have to identify, well, what is our ideal self? What's my ideal self? Well, I'd really like to be more empathic. I'd like to help others more. I'd like to actualize some of my dreams. Maybe I'm good at music, but I've never pursued it. Maybe I've always wanted to write, but I've never tried. Whatever it might be. What are my hopes and dreams for self? What do I need to do to be more genuine, to be more of my authentic self? And how far away is the real self from that ideal self? And the further the distance, the more incongruency. The more incongruency, the more anxiety. So part of therapy is to begin to bring the real self closer to the ideal self and to create congruency. One of the things that has to occur is that the therapist doesn't have to be perfect, but they do have to be on this journey as well and demonstrate some congruency or at least authenticity to the client. I'm not going to be fake with my clients. I'm going to be authentic with my clients. All right. When a client begins to experience positive regard independently of others, she or he develops a need for self-regard, and imagining of the ideal self, conditions of worth are interpreted in relation to self-regard. Experiences are avoided or sought after based on possible contributions to self-regard. Theoretically, a fully functioning individual has no need for conditions of worth or defenses. So, when an individual feels that there are conditions for self-worth or acceptance, defense mechanisms often arise. She or he is open to experiences. There's a congruency between the real self and the ideal self. All right, let's see. When there is a lot of incongruency between the real self and the ideal self, people tend to hold distorted perceptions of their phenomenological self, their subjective reality, or who they think they should be, rather than who they are. They may use defense to protect themselves against experiences not fitting their conditions of worth. Defenses may also include selective perception, distortions of an experience, or denial. Person-centered counseling helps to lower defenses, draw attention to the person's subjective reality. Eventually, the real self and the ideal self will benefit from a healthy subjective reality and move closer to congruency. As a result, that also lowers anxiety and raises a healthy level of personal functioning. So here we created a continuum of change. So let's look at this diagram here. And we actually created this diagram, this table. So there's fixity, movement, and fluidity. And from left to right, it becomes more positive. So here we have continuum of change through person-centered counseling. So we might start an experience of incongruity and distress. The movement is the act of becoming. And by that I mean, through awareness, becoming our genuine, authentic self. And then the result is fluidity, an experience of congruence, peace, self-actualization. Over here we have understanding experience in a rigid manner, perceived as external facts. So everything's based on external judgment of us, or even self-criticism. And then the movement, a loosening of the cognitive maps established from past experience. Meaning is modified with each new experience. So maybe I felt judged in previous experiences, but I'm changing that cognitive map. Now, my personal meaning is being modified with every new experience in a more positive way, in a less judgmental way. If I was judged, that's about whoever judged me. It's not about me. And then fluidity, being focused on the present, being able to move into present rather than always worrying about my past experiences affecting my future experiences. So maybe I was judged in the past and I incorporated that, believing that in order to be accepted, I had to meet others' criteria. And then worrying about, well, how am I going to act in the future to please others, to gain their acceptance so that I will be judged worthy of love and acceptance. Instead, my meaning's modified, and I no longer believe that judgment from others is valid. And I learn to accept myself and my imperfections. And if I choose, I can grow and change in a positive way. And that results in No longer being focused on past or future, but being focused on the present. Being more acceptance of self. Accepting of self. Over here on the left, we have a conflict between the real self and the ideal self, an unwillingness to communicate self to self or gain personal awareness. And here, the movement, a decrease in defensiveness, increased awareness of the previous inaccuracies of the real self and ideal self, and an openness to discovery and change. Here we have fluidity, ultimately a reorganization of our self-concept, with little discrepancy between the real self and the ideal self. Over here we have fixity, stuck. I'm stuck. Problems are unrecognizable. I'm not even aware of the problems. And there's no desire for change. As self-awareness begins to occur, we have a recognition that, hey, there's a problem existing here. I'm not entirely the result, and it's not entirely the result of external forces. And then the fluid result, increased self-responsibility and living with problems subjectively. And lastly, over here, avoiding close relationships that are perceived as being risky or dangerous. So we don't want to be rejected. We fear rejection and judgment. Movement, an increase in appropriate risk taking in interpersonal relationships. Remember in the last lecture we talked about loving others is based on trust, and trust takes vulnerability, and vulnerability is a risk. And an increased tolerance for personal vulnerability. Living openly with others, behaviors are in relationship to the immediate experience. It's kind of an application of this theory. So let's move through this a little bit and look at some of the techniques. Active listening. Being there, being present, giving other or our clients our full attention in the use of appropriate responses. The counselor uses reflection to convey the essence of what the client has communicated so that she or he can see what has been expressed. Clarification is used by the counselor to focus on key underlying issues and to sort out confusing or conflicting feelings. It can also be used to make sure that the counselor is on the right track. Summarizing points or themes, summarizing points out themes for the client, and the client can also summarize his or her own experiences. In order to empathize, the counselor must have an accurate understanding of the client's subjective world. It's the ability to grasp another's experience while maintaining one's separateness. So, subjectivity, subjective reality, empathy, understanding one's subjective world, that's important, but we still have to have healthy boundaries. Okay, so I'm not going to take my work home with me and constantly worry about clients. I have to have those healthy boundaries. Gentle confrontation is pointing out personal contradiction or incongruencies. Open-ended statements are used by the counselor to facilitate dialogue and thought. The student or client cannot respond to these with a simple yes or no answer. She or he must respond in more detail or in a narrative style. So I ask for a narrative. I ask for a story. This works very well in group counseling and multicultural counseling. One thing I'd like to mention is that Carl Rogers' daughter, Natalie Rogers, wrote one of the first books on expressive arts therapy. continued to apply his theory in a very creative way. And it's a wonderful book. You can use Roger's theory, both Carl and Natalie, in art therapy, music therapy, dance therapy, movement therapy, narrative therapy, and the list goes on. In mindfulness. So there's just so much we can do with this. It seems like a very simple theory with very simple concepts. That's the paradox. In one way it is. But in another way, it really takes an incorporation of genuineness, unconditional positive regard, empathy, an incorporation of all of these skills and techniques to really create movement and awareness in self and others. I think it's a very, very positive theory, and it is a wonderful theory to use in any spiritual setting.